Hi, I'm Mark Roberts, President of Muskogee Community Hospital. I'm going to spend a few moments talking about our hospital and what makes us special. First of all, we're a physician-owned hospital, and by that I mean we have a bunch of doctors in Muskogee that came together, took a ton of risk to put a hospital together because they wanted healthcare to be different, they wanted healthcare to be better, and they wanted their patients to be taken care of. When they had us go down that path, the next thing that happened is we worked on building a green hospital. We started by having geothermal heating and cooling. So we have 280 wells, 300 foot deep in our parking lots that are used to heat and cool the building. Where that's an advantage to you is every patient room has its own separate air conditioning unit, its own heating unit, all controlled by you in the room. By having geothermal heating and cooling units in the hospital, we were able to then put UV lights in those units, and those UV lights kill over 99% of all airborne bacteria. So in each individual room that has each individual unit, it's just got its air, and as the air cycles through the system, the air is sterilized. We think that's very important for a patient, and that's some of the thinking that the doctors went through to make it better for the patient. And while we're talking about UV lights, another thing we did is we put UV lights in the ORs, in the ceilings, and they shine down at night. They have sensors in the doors. They have motion detectors so that you can't go in there and look at them. And those lights sterilize the room. Anything those lights shine on sterilizes, kills every germ on any surface that the lights shine on. We think that's important as well for a patient. And the fun part about this is, as we've been in business during our whole existence, we've never had the opportunity to find any bacteria growing. So we've killed everything that's been here, and nothing's been able to germinate. So we feel very fortunate about that, and if it's you, it would make a difference. Again, thinking of what the doctors want and how they want to make healthcare better. Once we went down the energy side of it, we were able to then go down the whole sustainability side, and we ended up being the first for-profit hospital in the entire world to get LEED Gold certification. And where that's important to you is the things that we've done in the hospital to make it easier for you. We have what they call low VOC paints, and those are paints that have low volatile organic compounds. And what that means to you is those paints don't smell. Where that's important is at least half the people in the hospital have breathing issues, and we haven't done anything to make that worse. Our hospital sadly didn't smell new when we opened it, but it also didn't have any smells that would exacerbate any kind of breathing problem someone has. Again, another thing we did to make it better, we have antimicrobial paint on the walls. We have carpets that have been recycled with antimicrobial characteristics to them. We've done everything that we possibly can to make it a better environment for you, the patient. We even went so far as to make the rooms feel like a hotel room. Other than the medical gases that we have to put in there to make it where we can actually be a hospital, we did our best to make the room feel comfortable and more a hotel-like setting. We have wireless internet for your convenience. We even have first-run movies you can watch while you're staying in the hospital. Again, another thing we've done to make your stay better. You're watching this video because you're considering using Dr. Grosby in our hospital for your services. I've said a little about our hospital, but I want to talk a little about Dr. Grosby. Whether he'll tell you or not, he's one of the 10 top surgeons in the country in bariatric surgery. He is very meticulous, he is very focused on the patient, and he's always learning the newest and the latest procedures. Your success is his top concern. Thank you again for watching this video, and I hope you choose our hospital. Have a great day.
Hello, I'm Dr. Louis Grosby. I'm a general surgeon and also a bariatric surgeon. This video presentation is about the bariatric program at Muskogee Community Hospital. I am the bariatric surgeon of that program, and this video presentation is also your informed concern. So I would like you to listen very intently so that you'll understand what is surgery all about. Hopefully you will fully understand what bariatric surgery is and what we can offer you. Whatever questions you have, I will be glad to answer them when you come for your consultation. Since 1979, I have performed 5,000 bariatric procedures. Bariatric surgery is different from other forms of surgery. A team is important to ensure the safety of the patient. Bariatric surgery is different from other forms of surgery. We need a team of specialists and allied health professionals to manage your care. These are the key team players. We have psychologists, cardiologists, and pulmonologists. And for those who will undergo gastric bypass, you will see a gastroenterologist. These are the topics that you're going to learn today. Our goal is to educate you about bariatric surgery. What is obesity? Obesity is a disease of excess fat storage with a number of associated diseases known as comorbidities. It's also multifactorial. It's a lifelong and progressive, potentially life-threatening, and very costly. How do we measure obesity? Body mass index is a measure of body fat based on height and weight that applies to both adult men and women. 18.5 to 25 is the acceptable range, and after that, you start to be classified as obese or overweight. There are many factors that influence obesity. If you were born with genetic predisposition to become obese, it will be very hard for you to lose weight. There are hormones that influence obesity. Ghrelin is the most important one. Ghrelin is a hormone that's produced by the stomach. When we are hungry, the brain will stimulate the stomach to produce ghrelin. Ghrelin is a hormone that will stimulate the brain to think of food. Leptin is a hormone that prevents us from storing fat and also increases the utilization of fat. GLP-1 and GLP-2 are hormones that influence diabetes. It's produced by the proximal small bowel, which is bypassed in urinary gastric bypass. You're not alone. About 65% of adults are overweight, and about a third of our children are also overweight. 4.8% of adults are morbidly obese. The total cost of obesity in 2003 was $75 billion. So we could imagine how it increased at this time. There are 325,000 obesity-related deaths in 2003. Latest study shows that 400,000 obesity-related deaths occurred in 2009. If we do not change the trend, then morbid obesity will be the leading cause of preventable death. This graph shows the distribution of obesity in the United States. Here's the relationship between obesity and mortality risks. As you could see, if your BMI is between 20 and 25, you have a very low mortality risk. As your BMI goes higher, your mortality increases. I would like to note also that if your BMI goes very low, then there's also increased risk of mortality. The younger you become obese, there's an increased risk of dying prematurely. Studies show that teenagers who have a BMI of more than 40 has an 8 to 13 years shorter life. These are the illnesses associated with obesity. Type 2 diabetes is also called adult onset diabetes. If you developed type 2 diabetes after gaining weight, then there's a big chance that after Roux-en-Y gastric bypass and gastric sleeve, your diabetes will improve immediately, especially if you only take in one pill. And in laparoscopic adjustable banding, you have to wait to lose weight before diabetes will improve. And hypertension is like diabetes. If you're taking only one pill and it's controlling your hypertension, there's a big chance that your hypertension will improve right after the surgery. Hyperlipidemia is increased cholesterol and increased triglycerides. Usually it takes several months before this improves. Your cholesterol and triglycerides will be retested within 3 to 6 months after the surgery. It's been proven that 98% of morbidly obese patients has a sleep apnea. You will all undergo a sleep study because we need to treat the sleep apnea before the surgery. It is very important that you learn how to use your CPAP or BiPAP machine before the surgery. This will surely prevent you from having respiratory complications. Depression. I would say 60% of my patients are taking antidepressants. Out of those who are taking antidepressants, I will say 70 to 80% will stop taking their medications. Their situational depression will improve because now they'll be very active and be able to participate with the activities of the family. Menstrual irregularity. Obesity can cause hormonal imbalance. There's also a big chance that after losing some weight, your hormones become normal and you might ovulate. I would recommend to use a contraception right after the surgery because there is a chance that you might become pregnant even if you could not become pregnant preoperatively. If you are taking birth control pills, I encourage you to stop taking the pills 1 month before and 1 month after the surgery, since birth control pills can increase your risk of developing blood clots. Urinary stress incontinence. These are for women who had normal deliveries. The pelvic floor becomes weak and the bladder falls down. When the bladder falls down, you start leaking urine when you strain. The pressure from the abdomen from being obese will aggravate the situation. The surgeons are hesitant in operating on you while you're still heavy to correct the stress incontinence because there's a big chance of recurrence of stress incontinence. After losing weight, some of the patients will not require the surgery anymore because the symptoms improve. Asthma and pulmonary disorder. I've noticed in my patients that their asthmatic attacks have become less frequent and less severe. Gastroesophageal reflux disease is a condition